Hello, everyone. Welcome and thank you for joining us for today's webinar on practical steps to support your team's mental health, proudly presented by PracticeHub. In the spirit of reconciliation, PracticeHub acknowledges the traditional custodians of country throughout Australia and the connections to land, sea, and community. We pay our respect to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Thank you for joining us for the latest PracticeHub webinar. We have a great panel with us this afternoon who will be addressing some of the many questions which have come through during registration, which we thank you for. On our panel this afternoon, we have Gallary. Kay has over 30 years experience in the health and medical profession. Her career path to date has involved building solid leadership and management experience in strategic and business planning, business development, project management, risk management, quality systems assurance, and human resources management. Joining Kay, we have Anna-Maria Gibb, the co-creator of My Practice Manual, now PracticeHub. Anna-Maria has a background in practice management and qualifications in business and adult education. I will now hand over to you, Anna-Maria.
Lovely. Thank you, Katrina, and welcome everyone. I'm super excited this afternoon that we have Kay presenting for us on helping your team with their mental health. So a quick overview of what we're going to be talking about. We're going to look at positive leadership style and team culture. We're going to look at how to reduce the stress in your practice and some self-care strategies for you and your team, especially in these challenging times that we're going through and have been through as well. So Kay, let me hand over to you to get us started.
Thank you, Anna-Maria, and also the PracticeHub team for inviting me on behalf of My Practice Services to present to you today. I'm really looking forward to providing this presentation, so thank you again. Well, as Maria just noted, it certainly has been a tough time in the medical profession over the last 2 years. I don't need to tell any of you that. The COVID situation has impacted us all had to deal with differences in running our practices, in coping with all the different strategies that have been pushed at us from the government, in supporting our teams through this transitioning time. And also we've had an impact on, obviously, people's mental health in relation to this, just coping with the enormity of the situations that we've been dealing with. That's also impacted on staff, and some of our staff have left practices. And we know that recruitment is also extremely difficult. We acknowledge that this has been a very difficult time for people, and we understand that people are feeling burnt out and people are feeling exhausted and stressed about this. But we do need to take this situation as an opportunity for regrouping, repositioning ourselves to look at what we can do in this environment going forward. Let's get back to basics around this whole area of mental health, because it fits under the Work Health and Safety Act, which states that persons conducting a business or an undertaking have the duty to ensure the health and safety of workers at their workplace. So this is not only now looking at obviously the physical environment, but it's looking at the psychological environment within your practices. So keeping the staff within your practices healthy. So over and above that legal requirement, one of the other facts that we need to be aware of, and there has been an excellent paper that has come out from the Black Dog Institute in October of 2021, and that's called Modern Work, How Changes to the Way We Work Are Impacting Australians' Mental Health. And what they've stated in that paper is that emerging research regarding mental health since the onset of COVID has sent a very clear message that the mental health of Australian workers, and particularly younger workers in the 18 to 34-year-old age range, is under threat due to the disruptions to work and to social lives. So we know that a lot of our staff in medical practices are actually in that age group, but we also know that report also points out the fact that everybody, no matter what age you are, no matter what occupation, that the psychological distress caused by COVID has increased people's psychological distress from 2017 to the 2020 to 21 data that has increased. So the two facts are we've got a legal system that is reminding us that we have to look at this issue. And the fact is we do have, within our workplaces, we do have an increase in mental health issues that are impacted since COVID. Let's have a look at what we can do. So those are the facts. Yes, we do have a problem, but this presents us with the perfect opportunity, as I said before, to reset and to put into practice what we can control. And one of the first things is looking at a healthy workplace culture. So when we look at culture, we are looking at that environment that we create within our workplaces, and having a healthy workplace culture is really the cornerstone for setting positive psychological health. So these are the 7 pillars of a healthy workplace culture. We need to show leadership, commitment to having a mentally healthy workplace. We need to develop supportive and capable managers and leaders. We need to implement workplace policies that support psychological health and flexible workplace practices. We need a practice that's respectful and dignified in all the interactions that go on within that practice, which comes down to communication and consultation with our staff. We need to build awareness of psychological health and safety, and we need to model psychological care. So these pillars are just so important to establish a healthy workplace culture. And across Australia, Safe Work Australia, in every state and territory, has information and resources. They also provide professional development education. So if you're looking for education for your staff on some of this information, you could certainly contact Safe Work Australia within your own states. So the first aspect there is about leadership, and leadership is just so important. Leadership is about empathy and perspective. And as Simon Sinek, an author, quite well-known author, which I'm sure a lot of people listening have heard of, Simon Sinek says it's not about being in charge, it's about taking care of those in your charge. And he says, remember the FBIs, that your leadership style is going to have an impact on the feelings and behaviours of the people in your practice. So think about the feelings, the behaviours, the impact. And your leadership style, therefore, needs to be looking at that communication style, thinking about how that style is going to impact on the feelings, behaviours of the staff that you're dealing with. I know that a lot of people that we've worked with in MyPS have come up through the ranks of being a receptionist and then a senior receptionist, and may have got to the position of practice manager. If that's the case and you haven't had the opportunity to develop leadership strategies, we would certainly encourage you to look at that as a professional development activity for yourself and think about improving that aspect if you feel that that's what you need. So these are the 10 leadership skills. As I mentioned, we're all works in progress. We're all not perfect at these things. They grow and develop as we grow and develop. But it is really important, as I said, to have a look at where you sit within these skills and whether in fact you need some assistance. And having a mentor and somebody that you can talk to that is going to provide some support for you developing these skills is really important. So you can read those 10 skills there that are up on the screen, but really in terms of mental health and looking at the mental health of our practices and our practice staff, certainly the communication is so important. The demonstration of high emotional intelligence in being able to pick up what's going on in your practice and being able to work with your staff to solve some of these issues, to be able to promote healthy failures, because that goes on in our life. We're not perfect. As I said, we're all a work in progress. And it's about making difficult conversations more easily and being able to practice effective communication styles. And again, these sorts of things do take practice, and also delivering constructive feedback. There's 10 things there. As I said, I don't want to go through all of them individually, but these skills certainly make for effective leaders and are so important. It's about working as a team. It's not just you as a practice manager, but it's working with your practice principals and leaders to be able to lead your team when you're looking at mental health within your practice. The next thing was on that list originally in terms of culture was looking at policies. And I'm not going to go specifically through the policies that are here because Anne-Marie will follow that up after the session. But this issue of having policies in place that support psychological safety and flexible workplace practices is just so important. I've listed a few there. Anna-Maria is going to go through these in more detail later and link you with the specifics within PracticeHub that deal with this. So what sort of process do we need to follow to identify whether we are actually operating a mentally healthy workplace? This process is basically a risk management process. I'm sure that you follow these risk management processes in your practice. And for healthy workplaces, it's exactly the same as any risk management process. What's most important is that it needs to be a consultative process where you get your whole staff involved in this. Consultation is the key here. And so in terms of the process, I'm going to go through these steps in more detail next. I just wanted to outline the process to you first of all, and to really reiterate this issue of consultation. So step one is to identify what those workplace psychological hazards may be, then to assess what those risks are. Step three is to control those risks, and step four is to review. And in that review process, you may need to make further amendments and go back and do that whole process again. So let's move on to the step one. So having a look at what your workplace hazards are in relation to psychological health, that can be broken down into three columns. It can be looking at job factors. The second one is operational or team factors. And the third factors are organisational. So if we go to job factors, look at your practice in terms of these particular 6 issues. Job insecurity. I've been working with a practice now where everybody within that practice is, apart from the practice manager, is employed casually. So the staff within that practice are feeling very insecure about their jobs, particularly since COVID happened and there were thoughts that practice may have to reduce its staff. And therefore, if people are casual, this particular group of staff were feeling very insecure. And what they feel is that when they get brought in to have any discussion with a manager, for instance, they think that their job's on the line. So if that's an issue, then that needs to be highlighted as a hazard for those staff. If people are feeling isolated in a work environment, they're doing a job that nobody else is doing and they're feeling very isolated. If there's lack of role clarity, if there's reward imbalance. In one other practice that I worked with, people were feeling that one person was getting all the attention, getting all the focus, and they were doing exactly the same sort of job and not getting any response in terms of the good job that they were doing. Role overload, where situations happen where people are off sick or going on holidays and another person is picking up that receptionist or admin's role as well, then that's taking on that role can feel that there's overload for them and they may feel unsupported. And if people don't have any control over their job, they feel as though they just don't have, whatever they're saying is just not being followed through or not being taken notice of. Any of those things can cause stress within the workplace. From an organisational perspective, workplace conflict. I'm sure we've all seen that, where people may not get on, and where things like this happen, it needs to be addressed. And this is about having those difficult conversations. It's about raising these issues before they fester and grow, and then it may become a bigger situation than needs to be if it was addressed early. Bullying and harassment, violence and aggression within the workplace. This is about administration or reception staff dealing with difficult clients, that type of thing. I'll address that again in a minute. Poor support from managers or workers, hazardous work environment. That's really more on the physical side, I think, but it needs to be thought about in this context. And certainly if there's limited resources or support. From an organisational perspective, it's about looking at the culture, as we've talked about, and that leadership aspect of things, where there's going to be change, and change management is a particular skill. So if people are not brought along with that in your practice, another practice I'm dealing with, there's potential that a subsidiary of this practice, another branch of this practice is going to be open up, and nobody within the administration team knows very much about this at the moment. So there's a lot of whispers going on about what's going to happen. So organisational change is about bringing people along with you, and not keeping people in the dark, because it just tends to create the Chinese whispers that may get out of control and create a stressful environment. And poor procedural justice, where fairness and transparency, where people think that one person is favoured over another, one person does something and suffers the consequences of that, and another person does exactly the same thing and it's not dealt with in the same way. So it's really important, as I said, for you to think about this from your practice's perspective. Look at this in the first step of identifying for you what are your workplace hazards. So then how do you look at these psychosocial risks in terms of an assessment process? So you've got to look at the duration, the frequency, and the severity. So here's a few examples that we at MyPS have dealt with over our time of working with practices. Certainly dealing with difficult patients without support. It's quite a common issue that comes up within practices where reception staff don't feel they've had the training and the support to deal with this. And they don't know what to do, how to deal with the situation, and how to de-escalate patients when they are making complaints to them either by phone or face-to-face. So if that is an issue within your practice and you only get that from consultation, then that can be something for you to think about at this point as what are you going to do about this situation? A new receptionist feeling overwhelmed with their role very often happens. And again, how often is this happening? Is this happening every time a new person comes on board in terms of your practice, or is this just something that happens every now and again? Administration staff lacking role clarity and feeling frustrated. Again, I'm going to look at the next step with this, but I'm just highlighting some of the things that may be happening within your practice that you can look at from an assessment perspective. And poor interpersonal relationships. Are all your staff getting along, or is there some tension between some of the staff there? So we need to assess that, and then we need to look at how do you put into practice some control measures and decide from these measures which ones are the most effective. So if you've got reception staff who haven't had any training in dealing with difficult clients, and that's an issue for your staff, then it's about providing them with some professional development, some training in how to deal with this. How do you de-escalate people that are getting more and more and more intense, either on the phone or, as I said, in face-to-face situations? With new staff who are struggling with their role and they're feeling overwhelmed, have a look at your induction program. Is that actually providing them with the induction that they need to be able to do their job? And how are you giving feedback on that? And is that a very quick induction program, or is that an induction program that rolls out over a number of weeks so that they get to learn each new task as they understand that and move on to the next one? In terms of role function, it's about looking at your role statements, your position descriptions, job descriptions, however you call that. But look at those statements and ensure that they accurately represent the tasks that's expected within that role of receptionist or whatever it is within your practice, and make sure that the person understands what their role is and their induction program dovetails into that. And then review your performance management process. Have a look at how you do that, how you give feedback. It's so important to give people feedback, particularly 6 weeks after they've started in a role, and then again 6 weeks after that. If people just get put in a job and don't receive any feedback at all, they're feeling unsupported and they can feel very stressed about that. So it's about implementing those control measures. You set a time frame for reviewing that, and then you review it to see whether that in fact has been a successful outcome, or whether you need to go back and repeat that process again. So this is all part and parcel of looking at creating a healthy workplace. We've looked at the leadership. We've looked at a process in which you can, with consultation, draw out the issues within your workplace that are causing stress, causing people to feel under some sort of psychological impact. And it's about addressing that. And what is so important is to record this. It's about taking it back to your management committee, if you work with a management committee, or with your practice principals. If it's not written down, it doesn't exist. My daughter's an employment lawyer. She tells me this all the time. She says, if it's not written down, it doesn't exist. So you need to record your process, record what your outcomes are, and include that consultation with your workers so that you've got a record. And again, Anna Maria will pick this up when she talks about PracticeHub, because that's a perfect way where these sorts of things can be written down. So I can't stress enough how much communication in a practice is just so important. Within my practice services, we always talk about the fact that communication is one of the key factors to achieving what you want to achieve within a practice. In terms of how you communicate, we talked right at the start about dignified communications within your practice, communicating respectfully and honestly and with authenticity as well. And sometimes when we're stressed, we don't do as good a job at communicating as we could. So I've just highlighted here some communication statements that I hope you find respectful to the person that you're dealing with, and just give you an example. So saying to a person that you want to have some contact with, do you have some time this afternoon? I have some feedback I'd like to discuss with you. I'd like to talk about X and get your point of view. Can you come and see me tomorrow? Especially when we're talking about feelings, people that we might be picking up are struggling. I understand that you are feeling a bit overwhelmed at the moment, for example, and I'd like to hear your thinking about this. Are you free to talk about it this afternoon? I'd like to see if we might reach a better understanding about your role. I really want to hear your feelings about this and share my perspective with you as well. Would it be okay if we sit down and discuss it on Wednesday? I think, as I said, we really need to communicate in a way with our staff that shows that level of respect and dignity to them as valued members of our team. So how can we create a healthy wellbeing environment? We need to thank people for their efforts. I remember once being in a practice where I saw the practice manager at the end of the day going around to each person and saying, thank you very much for that job that you did today with X. You did a terrific job of that. And I think being able, as a manager, to be able to provide this sort of feedback to your staff is so important and makes them feel valued. They're there providing a service to the community every day, and thanking them for their efforts and what they've done is just so important. And just a simple thanks makes such a difference. And I really saw these people really feel good after their manager thanked them. You can offer team-focused activities like lunches or outings and social occasions. A practice that I worked with last year, it was a specialist practice. They actually closed their practice for one day, and everybody within that team were taken out for the day of team building, if you like, but it was a way that the principal of that practice was able to thank the staff for the job that they'd done through that COVID period. So they did go-karting, they did an escape room, and they had a lunch. And the practice, as I said, was closed for the day. Now, that may not be possible for every practice, particularly general practices, but it was very much appreciated by the clinicians and the staff that worked in this particular practice. Highlighting practice achievements at team meetings, that's a really good opportunity to talk about the achievements that you've made, particularly through this last 2 years that we've all been through, and how much people have had to put in and change and pivot and work around the directives we've had from the government around COVID. Introduce a rewards incentive program. I noticed, Anna Maria, that one of your staff got a pat on the back today on LinkedIn and that was a reward example. So, these little things just make such a difference. And getting your staff to take a break at lunchtime. I see so many people just working or sitting in the staff room at lunchtime, and it's just good to get out and go for a walk and get out and have a break away from work. And of course, it's about looking after you too. And I think we all need to think back about Ash Barty and what a great role model she is for nurturing the best version of yourself. Ash Barty had a mentor and life coach called Ben Crow, and she worked with him to always go out onto the tennis court to be the best version of herself. She wasn't going out there to win. She didn't really take any notice of what the outcome was. Obviously, she wanted to win, but if that happened, that happened. And if it didn't, it didn't. It was about being the best version of herself out on the court. She's such a lovely person. She was always very respectful to everybody around her. She had a team around her. And I think we can take note of that when we go into our practices, when we go into our jobs. We can take with us the best version of ourselves. We can set boundaries because we can't please everybody all of the time. We can't be available to everybody all the time. It's about putting boundaries around ourselves in terms of dealing with the stressors that may come invariably. Refuel yourself. Do whatever it takes to put back into your own jug so that your jug is as full as it can be. And that might be a massage. It might be spending time with your family. It might be getting out in nature as much as possible. It's going to be different for every person, but whatever it is that makes you happy and gets you refueled is what we need to do to look after ourselves, because we ultimately are responsible for ourselves. And be aware of your mindset and acceptance. We can't change COVID. We can't change the fact that it might be raining every day like it has been here in Adelaide for ages. There's things we can't change, but we can accept the things that we know are there, and we need to take control of what we can, which is what this whole talk has been about. And we need to reflect back, sit back and reflect about what you've done that's been great, and reflect about how we can make improvements within our practice. So that's taking a leaf out of Ash Barty's book. But I will also just say that to finish off on this acceptance aspect of things, Georgie Harmon, who's the CEO of Beyond Blue, says, accepting the hard reality of a situation can sometimes be the key to blunting its sharp edges. And I think that's very, very true. These are the references that I have referred to in this presentation today. I know that you're going to get a copy of all of these sent to you later on, but certainly in terms of, as I've mentioned, Safe Work Australia in every state. If people within your practice are struggling, they may need to have some psychological, practical support that can be provided by Employee Assistance Professionals Association of Australasia. There's MindSpot, which is also able to provide people with psychological assistance. Heads Up is creating a mentally healthy workplace. And there's a guide there for business leaders and managers. Obviously, that we've talked about Black Dog Institute. So there's a whole range of resources there that people can access. But certainly, as I mentioned before, the mentally healthy workplace concept has been around for quite a long time. And the reason for that, obviously, is that the psychological hazards in a workplace are something that's very much of the focus at the moment. So there's all those references there. And thank you very much for listening. And I'll hand back over to Anna Maria.
Fantastic. Thank you, Kay. That was just really great. I think one of the things I thought about while you were speaking is, I don't know about everyone else, but sometimes when you hear sort of psychological, you think, oh, it's a bit fluffy. Where are the specific things that you need to do to help with that? And I did think you're communicating effectively. Those sentences that you had, like the opening, I've got some, I'd like to, you're feeling this, I'd like to discuss it. I thought they were probably really good opening lines when you go to have a difficult conversation with someone. So I don't know if you agree with that. But also off the back of that, we do have a question about performance appraisals, and basically asking if they're done too frequently, will they cause emotional and mental stress for the staff? So what are your thoughts on performance appraisals and, I guess, not creating that stress for people?
Sure. Look, from a MyPS perspective, what we like to do is to use the performance appraisal system based on the person's job description. So we've talked during the presentation about role clarity. And I think if you can align your performance appraisal with the person's job description, then what you're giving feedback to that person about is the specific tasks within their job description. So I think it's really important to set performance appraisals up as a two-way communication between the person and yourself in terms of dual feedback. A lot of people think about performance appraisals as being a potentially punitive situation, and it's really about the person being able to give feedback to their supervisor, manager, as well as that person being able to give feedback to the employee. Because if you don't sit down and talk with somebody about how their job is going when they first started and they've been there for 6 weeks, it's about trying to fix up any issues that have arisen during that 6 weeks based on the person's job description and based on the induction program that they have been through. So coming back to what your question was, Anna Maria, I think at 6 weeks, it's really important to give people feedback after they've been in the role for 6 weeks. And now I think it's important to follow up with that person at 3 months. From the point of view of you don't really get into a role until you've been there for 3 months at least. And, depending on whether that person's full-time or part-time. So it's a two-way communication, and it's how you set that up, how you communicate that at the start. And then after that, it may not happen until the 6-month mark. And then from then on, it may be something that occurs every 12 months. But feedback to people needs to be an ongoing practice so that you don't wait for 12 months to give the person feedback about something that happened 10 months ago. So ongoing feedback all the time for a person within the practice is so important. But structurally, I think it's really important when people first to have that two-way communication about how this role is going.
Fantastic. All right. Thank you, Kay. I'm going to flick over and do a demonstration of PracticeHub, particularly showing you some of the policies that Kay referred to that we have in the system, and essentially the structure of the PracticeHub system, how it works, how you roll it out to your team, and the training modules that relate to the areas that Kay has talked about today. All right, so those of you who have PracticeHub would be familiar with the dashboard that you're seeing. This is normally what our administrators see. The regular users are much more kind of view-only access, so they don't have as many things going on their dashboard. So first of all, I might show you the policy and procedures manual. And having had a look at Kay's slides before we started today, I've put some of the policies and procedures that I think are really relevant into just this one section. But overall, depending on what type of practice you have, our suite of policy and procedure templates can be laid out either in alignment with the RACGP standards, or for specialists, it'll have a different layout. So, and of course, you can customize that in any way that you like. But first up, let's have a look. So I did like Kay's comment about if it's not written down, it doesn't exist. So bearing that in mind, these policies are really important. And I think also one of the things that was mentioned was about setting the culture of your organisation. And I think by having this transparent, accessible information for your team really helps build that culture. It says to people, we've thought about these things, we've documented them, and you can see what our expectations are. And you can see how we maybe, what training we have, if you need support, how we go about doing that, and so on. So I guess starting with the work health and safety policy and procedure, and I went through and sort of was looking and thinking, you know, we often think this is about physical safety, but it really is also got to take into account psychological safety. So things around, you know, acting on recommendations in a timely manner. So if somebody has brought you some issues that are causing them are a risk, a safety risk, that you act on those recommendations. I've also highlighted the one here about scheduling regular breaks for staff. And again, you know, Kay's comment about get out, go for a walk at lunchtime. And I do often hear comments about, you know, is it all right for staff to leave the practice at lunchtime? Should they stay? And I'm like, you know, I think we all know if they stay, there's always a risk they'll get called for something and then they don't actually get that good mental break. So really important, I think, to reinforce that as well. So there's lots of different areas that are covered by that. And of course, another page I'll show you is around the practitioner and staff health and wellbeing, but certainly important to factor that in. The other thing that we talked about was things like role clarity, having good job descriptions and things like that. And again, I think it's really important to sort of look at what are the tasks that need to be completed, who is responsible for payroll. And one of the things I think it's really good to do is to do a matrix of who actually can do these things, so that there's maybe the primary person and then the secondary person who's the backup if that person is unavailable. And so that everyone is clear on what it should also do is identify any gaps. Oh my goodness, we've only got one person who knows how to do payroll. We probably need to do something about that. So having that clarity around the roles and who's responsible, I think takes a lot of the stress off people thinking, hang on a minute, is that my job? I don't know. So again, reinforcing that role clarity. We talked about the staff health and wellbeing. And again, the things I think that are really important to factor in any practice, not just GP practices, but managing the workflow, you know, when staff need to take a break, if people are unexpectedly absent, which of course, we've all lived through that for the last couple of years. Ensuring staff take the leave that they're entitled to, because again, that is part of supporting their health and wellbeing as well. Code of conduct. I think the code of conduct is really important because it sets the scene again around that cultural expectations and what's expected. So treating staff with respect, fairness and honesty. It's a safe, healthy and rewarding work environment. Treating staff and patients with respect and dignity. Again, these are things that Kay has talked about. Ensuring that your workplace is free from discrimination, harassment or bullying, because those are areas that are not only, I guess, a risk for the team in terms of psychological well-being, but also a risk to the business as well. So it's important to think of those instances as well. And again, probably thinking about scope and responsibilities and that, ensuring that people are working within their scope, or if they need to expand that, providing the support and training they need as well. And again, it's reinforcing. I feel like sometimes it sounds maybe we're repeating it, but it is in different contexts. It's important to have this documented and set that scene for the team in your practice. And again, as Kay mentioned, part of an induction process, I think it's really clear that we talk about that. And also, Kay, would you agree? You also need to tell people at induction How do they ask for support? What do they do if they're feeling stressed and things like that?
Yes, absolutely.
I'm going to show you our risk register in a moment, well, with a bit of an example, but essentially we are equipping staff with specific risk management policies, and then we're monitoring those risks regularly. And I really liked that table that Kay had with the 3 columns, because I feel like that is almost a checklist. How are we with, people feeling isolated, job overload, our organisational culture, all of those things. That is almost like a risk assessment checklist to go through and think about that, but that everyone has a responsibility for that. Now, I can't remember specifically if it is in the RACGP standards, but I know I've seen it recently, possibly in other standards, but I think, again, it just makes good sense to do staff feedback. We're focused on patient feedback. We're always asking the patients for their feedback. I think it's really important to have a way of collecting staff feedback as well. So whether you talk about it in meetings, you run surveys, you have the risk register and things like that, and looking at where you can improve your systems if you're identifying risks. So again, as Kay said, it really is it's a risk management process that you're implementing with this. And very importantly, regular reviews of your systems and procedures as well. So just because you've been doing it that way for a long time doesn't mean that it's necessarily the best way. And I suspect, harking back to the last 2 years, I think practices have become incredibly innovative and have had to been forced to look at their systems and procedures and review them to meet the changing environment. All right, so we've got policies around managing patients with difficult behaviour. We've got a policy around bullying, what to do in the case of violence in the workplace. But let me show you the organisation risk register. So in our risk register, which is a really simple table, again, it's more about you've documented it, because, if it's not written down, it doesn't exist, and you can follow that through. So here's an example. And, I was telling Kay that this was my thinking earlier, and it was around, that role overload, where maybe, when 2 or more people are away, whether it's on sick leave, carers leave, annual leave, it creates a psychological risk because people have this role overload. And so, our current risk control, as I said earlier, might be, we know we've got 2 people who can perform most tasks, so a primary person and a backup person. But currently, maybe that's just not enough. 2 people is not enough, being able to do each role. So the consequence of this is probably what I'd consider moderate, but the likelihood, particularly in today's environment, is very likely. So that would get a risk rating of high. And the way we determine that is through the risk matrix, which we have down the bottom here. So thinking about what is the consequence, what's the likelihood? And Kay, I think in your slide, you talked about duration as well. So if there was just as a one-off kind of thing, then you go, okay, well, maybe that's not very likely. So that would reduce the overall risk rating. But it is happening frequently, so the duration is also high. So perhaps, as a team, the practice team has sat down and said, all right, we've identified this risk. What might be some actions that we could take to help reduce the risk? And these are the things we can document in the register. So one might be reviewing our options to increase the number of people who can do these tasks. So we might upskill more people in the practice. We might need to recruit more people. We might think about outsourcing some tasks, maybe bookkeeping, payroll, phone overflow, that sort of thing. And as we mentioned in that previous policy I showed you, we might review our processes to see if we can streamline them to make it all more efficient, so that the impact when more than 2 people are away is not so significant. And this is our goal. Basically, we want to go back in a set period of time and say, do we think we have reduced that risk of role overload happening? So I really think it's valuable to document these things and to think about what action are you going to take, and then go back and review, did we achieve what we wanted to? Do we need to do something else? And again, from the PracticeHub perspective, having staff meetings, having set agenda items around things like work health and safety, which includes physical and psychological risks, is really important, so that it is open for discussion. You're basically setting the scene so people know that that's something that can be discussed as well. And of course, the beauty of PracticeHub is you can then attach the meeting minutes and people can go back and review them whenever they need to. So you've got a standing agenda that you go through, and that makes it a regular topic of conversation and something that makes it then more top of mind for people. So in addition to the policies and procedures, the other thing that I think is really useful in PracticeHub is the training modules that we have. So we have a series of 8 learning modules that cover, I guess, what we think of as the main areas of risk for people working in a medical practice. And the ones that I think are really relevant today, the work health and safety one. So we can see that practice team would get some information or some learnings around the Work Health and Safety Act. And I think, again, Kay mentioned that, I remember the process diagram where we had consultation on the outside there. That is one of the 6 key areas in the Act. So it is important that you factor that in when you're looking at your work health and safety processes, that consultation is included. Other areas, basically things like, handling violence in the workplace, you're providing some training around how people can deal with that in your team as well. Another module is the organisational culture one, which once again, we're talking around things like the code of conduct, workplace bullying, and equal opportunity and harassment. So again, what's in this code of conduct? And again, I think, you're going to get people to see these policies, they sign off electronically on the policies, but you're backing that up with some online learning as well. If it comes down to it, and we do have a case study for those interested. On our website, there's a case study about a practice that had a staff member leave and make a claim of bullying. And the practice was able to show that they had bullying policies or bullying policy in their PracticeHub site. They could show an audit trail that the person had signed off on them, and that really mitigated the risk. And in fact, I think that claim was basically not considered because they had such good evidence that they had policies, the person had viewed them, and they had signed off on them. So essentially no case to answer. So important to have these sorts of things available as well. And the last one is on risk management, which, it is a really good module in terms of just giving people that understanding of what does risk management involved. And a lot of the things that Kay had in her slides, identifying the hazards, identifying the risk, controlling those risks and so on, and managing adverse events. So between, I think, the policies, the procedures, the learning modules, you start to have some structured communication for people. You're setting the scene for them, and they get that sort of understanding of how things are done in that practice. Now, I just mentioned before how people can sign off on compliance, and you can see here we've decided this person needs to sign off. There's a banner, I, whoever, have read and understood and agree to comply, and they click on confirm, and you as the practice owner or operator have now got an audit trail that person has signed off on that particular policy. If you update it, you simply push that workflow through again and they can sign off again. All right, so I think that's probably the main things. Kay, you've given us some excellent tips and suggestions and resources as to what to do to reduce stress and improve mental health. Any comments that you wanted to add at this stage before we close out?
Just reinforcing what you've just said, Anna Maria, I think if there ever was a problem happening in a practice that required Avant or any sort of legal comment, the first thing that a legal representative would say is, where is your policy on X? And if you don't have it and people haven't read it, then really you don't have a leg to stand on. So these sorts of things are so important. And as much as we've talked about risk management and processes and putting those steps in place, it may sound like it's, an eye-rolling thing, but these processes and the ticking the box, dotting the I's and crossing the T's on these processes is just so important, and having the documentation. This forms the platform for the running of your practice, and it ensures that from a governance perspective, you've got all your ducks in a row. So very important to have those things in place.
Absolutely. Cool, thank you. If you're already a PracticeHub customer or client and you want to know more about how to use your platform, or if today my demonstration has raised any questions, please contact our lovely support team. If you're not a PracticeHub client, the best way to find out more is to visit our website and you'll find out the features and benefits. And you can also book a consultation with one of our consultants. It's one-on-one, so you get to talk about how your practice works and they can show you how the solution would work for you quite specifically. I mentioned the article about the bullying, but please go visit our website. There are many other articles that are really interesting, and also recordings of previous webinars. And don't forget to keep an eye out for invitations to our other upcoming webinars and register for those. And you can see if you have any other questions, please contact us on the email address on the screen. Can I thank you all for attending this afternoon? I know it's always hard to find time. And Kay, thank you so much. It's been really fantastic. And until next time, thank you very much.
Thank you.